Hello, I'm Diane Genthner. I'm our Chief Nurse and Vice President for Clinical Services at Provena Covenant Medical Center here in Urbana, Illinois. We are a community hospital. We're approximately 210 beds. We service our community in maternal child, emergency services. We have various outpatient services, procedure center. We do a lot of community type surgeries. We have med-surg, cardiac services. We have a critical care. We are associated with electronic ICU with our corporate structure in Joliet. We have a very robust cardiac service line with a cath lab, open heart surgery, just a full spectrum of meeting the needs of our community. Our nursing environment is research-oriented. We are headed towards evidence-based clinical practice. Our physicians are working very well with our nurses. The expectation of our nurses is that they use the intuition and experience they gain through their tenure here to work at improving the care that we provide to our patients. It's interesting, with nursing, typically in the past, we've gone with what the physicians have led as protocols. Now it's evidence-based and research-oriented. So for future trends in nursing, I believe that the nurse who knows how to research a topic that she's either not as knowledgeable on or wants to become more knowledgeable in is in her best interest. And again, it's not so much that you have to come here and figure it all out. The research has been done, and if you follow the standards for best practice, then you're going to be successful. The challenges for new nurses is their ability to work as a team. It's going towards multidisciplinary experience for the patient. In other words, those nurses are going to be working closely with respiratory therapists, our pastoral care, our social workers, our physicians that are at corporate in EICU, so you have telemedicine. So it's multidisciplinary, especially as we work with dietary. It's all in an effort to make the experience for the patient extremely robust, so that everybody has decisions that are made together, and no one is making one decision for the patient. And it's about continuum of care. So what do we do when a patient comes into our hospital to make sure that they're safe when they get home and they don't turn right around and come back in because of miscommunication and misunderstandings? I do. I have some really, it's an interesting time for nursing. It's how do you think outside the box and still use the experience and the standards that have been proven. So it's a culture now where we work hand in hand with family and patients and the team to make sure that the care that the patient needs is the best possible care provided. My first nursing job was at about 60 miles south of here in a small critical access hospital, and we did everything. So I not only worked in critical care, but I worked on the psych unit, and I took care of ED patients when they needed me in the ED, and I also did cardiopulmonary rehab. So the nurses were expected to do everything and weren't as specialized as they are now.